Hey, Trish, would you please do the roll call?
Yes. Reverend Duvall,
Present.
Jeff Smith,
Here.
Mary Taylor,
Here.
Twyla Lee, Dr. McBride,
Here.
Dr. Garza,
Here.
Ms. Schmidt.
Here.
Reverend Duvall, we do have a quorum.
Thank you very much. Our first agenda item is the election of a new advisory board chairperson. Right now, the floor is open. Are there any motions for the new chairman of the board? I'd like to make the motion that Jeff Smith be the chairperson of the board starting effective in this meeting.
Second.
I'm sorry, was there a second?
Second.
Okay. Any other nominations? There are no further nominations at this point. I'd like to ask for a roll call for the vote.
Trish, would you please ask for the roll call, please? Do the roll call here.
Okay, roll call. Reverend Duvall,
Yes.
Mary Taylor,
Yes.
Dr. McBride,
Aye.
Dr. Garza,
Yes.
Ms. Schmidt.
Yes.
Does Jeff Smith also vote or not?
I would recuse myself.
Okay. So there are 5 yeses and 1 excuse.
Okay, congratulations, Mr. Smith. By the powers vested in me, you are now the chair. Please proceed with the meeting.
Thank you for your service, Reverend DeVoe.
Yes.
Come on.
Thank you.
You're welcome. Thank you, guys.
Yes, thank you, Reverend DeVoe.
Yeah, I want to start by thanking you so much, Reverend Duvall, for your service the last year and a half. You've been a fabulous board chair. You have spent so much time inside this facility, getting to know people at every level and listening to people, inmates, staff, families of incarcerated people. And you've been an incredible role model and mentor for me. And I just want you to know, I want to recognize publicly just how committed you have been to this, how much time you have taken on this. And I know it's been at no small cost to you and your family and even your health. And so I just want to recognize your dedication and your service. Thank you.
Thank you very much, sir.
And I'd like to just thank my fellow board members for the faith that you're showing in me. I appreciate your passion, your diligence, all the reading that all of you do, every month, the time you take in between meetings that most will never see, and your perspectives. We have a very broad and diverse board, and my perspective, I appreciate all your perspectives. My perspective is shaped by the fact that 10 years and 1 month ago, I came home from prison. And the last thing that I told the people that I did time with was that I would not forget them or the 2.2 million people like them behind bars in this country. And so whether it was through writing and researching or working directly with returning citizens or now my service on this board, my perspective is shaped by wanting this to be the most humane correctional facility in the country and to do right by the people inside. And of course, a prison cannot be humane unless the people who are protecting prisoners and caring for them are also treated well. And so it's critical that we here ensure that our correctional staff and our healthcare staff are well trained, well supervised, well compensated, and well respected. And so I view our mission as a twin mission to care for everyone in this facility. So again, I thank you all for your confidence in me, and With that, let's move to the next item on the agenda, which is the approval of the November 20th, 2020 meeting minutes. Is there any, I guess, I will move for the approval of those meeting minutes, which have been distributed to all of us. Is there any discussion on the motion?
Jeff, I'll go ahead and second, and then we could move to discussion.
Thank you. Is there any discussion on the motion? Okay, hearing none. Hearing none, can we have a vote, a roll call?
Reverend Duvall,
Yes.
Jeff Smith,
Yes.
Mary Taylor,
Yes.
Dr. McBride,
Yes.
Dr. Garza,
Yes.
Ms. Schmidt.
Yes.
We have 6 yeses.
Okay, the minutes of the last meeting are approved. Thank you.
Jeff,
Next item on the agenda is our, yes?
could I just say one thing really quickly?
Sure, Mary.
I want to congratulate Penny on the minutes that we're seeing these days. And I think that's important because we've had minutes of these meetings in the past that we haven't approved because we thought they were incomplete or incorrect. Penny Martin has done a terrific job in my mind, and she gets them to us quickly and she records accurately, not just the words that are said, but kind of the feeling of the board. So I want to publicly thank Penny very much for her minutes.
Thank you, Mary, and I echo that. Can you all hear me okay on video? Yeah? Okay. All right, let's move to the next item on the agenda, our expanding partnership with the St. Louis County Library. We've got my old friend, Kristen Sorg here, the Director and CEO of the St. Louis County Library. Kristen, go ahead.
Good morning, everyone, and I'm glad to be joining you. Doug and I and some other people at the library had a meeting to talk about our partnership with the Justice Center, and that started about a year ago. We had a kickoff event where we started issuing library cards to individuals that were leaving the Justice Center. And that partnership kind of took a little bit of a pause because of COVID and just some other things. So we're still actively delivering library materials on a really regular basis. And that was also part of the kickoff about a year ago to the Justice Center. But we want to start back giving the library cards out. And there's a process that we have developed so that they can opt in to getting a card, and then they get it when they're released from the center. And we provide all kinds of information about the library and what they can use our facilities for when we're open. Obviously, we're closed due to COVID. Doug talked a little bit about some of the challenges faced at the center because of COVID, and that families aren't allowed to visit right now. And so we came up with a couple of other ideas to help the Justice Center with that. We do have Chromebook hotspot bundles that we are currently checking out to patrons. And so we thought that we could reach out to some potential funders who might be interested in assisting us with that so that we could get those to the families. And there would be it would be easier for kids and loved ones to connect with people that are in the Justice Center, and that we would try and do that sooner rather than later. And then we had a couple other ideas. We have it's called MindPlay software, and it's software that helps individuals with low literacy skills improve those skills. And we also talked about the fact that the individuals in the Justice Center will be getting tablets at some point, and we'd like to make content available to them, ebooks. We have a Career Online High School program where the library pays for individuals to get their high school diploma. and this could be made available. So we really just talked about a lot of things. It's definitely part of the library strategic plan to assist the justice involved in the community. And it's an area that a lot of us feel really passionate about. And so we're just excited to kind of kick off this partnership again and come up with a lot of really great ideas. I do think we could do some programming around individuals at the Justice Center. We do that for the Juvenile Justice Center. We have an individual that pre-COVID visited on a regular basis and did book discussion kits. That's something else that we're very willing to provide, is some reading kits where there could be a book that everybody's reading at the same time, and then there's a guided discussion with individuals that are in the Justice Center. So Doug, you can jump in, but we had a really great conversation and we just kept coming up with more ideas.
Right, and I'm especially excited about the family visitation using the tablets from the library. We'll be seeking donations or funding to get additional ones for the library. But we started the family visitation program here in the jail with donated tablets, and we've done about 330, 340 of those to date. I noticed several people turning down the opportunity, and I really couldn't understand why. And then I discovered that it's because their families live in poverty and they do not have smartphones or computers or tablets. And that's where the library turned out to be a real godsend, where they have this ability to, we're aiming towards where they could supply tablets to those people, and especially the children, and where we could also load educational and good programming on the tablets for the children there, or the library. So it's a real exciting opportunity, and it's one we hope to prioritize in the coming weeks. We are going to start in our enrollment package when at admission, everyone filling out that's willing to, and from St. Louis County, to get the library card, and they can start getting information on the programs that are offered by the library.
And Doug, anybody, really anybody can get a St. Louis County library card. So even if they're city residents, we have reciprocal borrowing with St. Charles and St. Louis Public and all the municipal libraries. So unless they're out from outside the region, they can get a library card and use our facilities.
Jeff, I have a question. I don't know if you can.
Yeah, go ahead, man.
So, Kristen, can they? I love everything you just said. It's just, terrific. Can they get a library card without having a fixed permanent address? Because some folks just don't when they're discharged.
We have a fix for that, and I don't remember off the top of my head how we decided to do that. But we're just trying, that's a barrier, obviously, for people getting library cards, and we don't want to be a place that's filled with rules, which is sort of the history of a library. And so we still have rules, but we don't want to make them so that people can't have access. So I'm pretty sure we had a workaround to that, but I'll double check in the application process.
Okay. And one more thing. So Doug, when you told us, I think last week or the week before, you were able to start family visits again, it was just terrific. I was so happy to hear that. And last week, I heard from a family who took advantage of the program, and just to put people behind this story is really important, I think. And those of you who've had young children know that sometimes out of sight is out of mind, and children don't really believe, even if they can talk on the phone, that their parents exist, the small children, if they don't see them. So one of the families that I talked to last week was so grateful and talked about the children and how they reacted. Once they stopped crying, they had a really good visit. But I know you all know this, but I think it's just so important always to put a child's face or a person's face on this, that that children who don't see their families for their parents for 9 months are under trauma and trauma on trauma. And to the extent that we can be, that you can be a part of lifting that and healing that, I'm grateful to be a part of it. Thank you so much.
Thank you, Mary. And I remember talking to a resident here where I was asking, what can we do to improve your time here? And I was expecting about food and other things like that, activities, but he was crying talking about not seeing his kids in a year is what he told me. And so I went downstairs and said, well, we're going to have to seek some donated tablets. And I found out that Tricia Rogers and Pat Baines had already put together a proposal for this and had got some tablets. We've got some additional ones too. And they just ran with it and did a fabulous job. Just took this on as an extra assignment. They're continuing to work it. And Tricia, would you explain what we're doing on Christmas as well with them, please?
We have another 400 inmates that we're scheduling for visits now through January 3rd. So we have Christmas Eve and Christmas Day that we're scheduling. So hopefully some of the inmates will be able to see their kids open presents or something that day. So we're already filled up on Christmas Eve and Christmas Day.
How many people in total for those 2 days?
Probably about 50 something inmates for Christmas Day, and probably 50 something for Christmas Eve.
Great. Okay. Thank you. And it's only going to get better with this partnership with the library. And in fact, it's going to get substantially better. And we're so blessed to have such an innovative director and CEO of a library like Bristol.
Well, that's nice. I have a lot of really talented employees too that help come up with really good ideas. So we're really excited. And Doug, and we just have to, after the first of the year, we'll have to figure out, we have some hot spots that I think we could take out of circulation that we have kind of just hanging out in case we need them that maybe we could use right away. So we just have to figure out the details.
Wonderful. I greatly look forward to it.
Thanks, everyone. Any other questions before I hop off? Okay, it was nice to see all of you. Timothy McBride, I follow you on Twitter.
That's awesome.
Okay, it's nice to see
Report thing.
everybody.
Yeah. Kristen,
Have a good holiday.
Thank you. You as well, Kristen.
Bye.
Okay, bye-bye. All right, well, it's fantastic to see this happening. As decades of research show that only 2 things over the last 50 years can meaningfully reduce the likelihood of recidivism, and those are facilitating close contact with loved ones and educational advancement during incarceration. And with this partnership, we're working on both those. So it's really great to see, and I think I speak for the board when I say we encourage continued expansion of the partnership. All right. Next, we will do the Corrections Medicine Dashboard, COVID status and 2021 COVID strategy, EMS operating model, Trauma in the Workplace project, and review the standard board communications model. Valerie?
Thank you, Jeff. Good morning, everybody.
Good morning.
The PDF version of the correction-specific metrics were sent out, and Aaron and my team continue to align all of the original vision of displays and how to present this information that the data subcommittee first worked on when we stood these up some months ago. So we continue on that, and in the meantime, then we'll present this way just for a little bit of consistency. So most of this I'll leave for you to look through otherwise, but to point out a few things that look different in the trends. So Tricia, thank you. Right where you are right there, the safety for the percentage of individuals that left the facility for medical care. You see that went up. That actually, though, was due to one particular patient who has had external consultant specialist appointments quite frequently. And we also began sending out dental patients because we're still constrained in services internally. So that's where you see the change in the trend there. Moving down to the next page with at the bottom metric that is shows the number of folks that have visited the infirmary for mental health care. We see that sharp trend upward there. One is due to using our now expanded mental health care provider team, but we also had identified last month that there was an operational error, as a user operational error, when we were navigating through the EMR, and those visits that were actually occurring just weren't getting tracked for where we then pulled that data. So we've addressed that, and it seems to be back on track. All right. And Tricia, if you don't mind, if you can go all the way to the bottom or to the last page, please. The last thing that I'll share with you about the metrics as they see here. So I'll call your attention to the positions that are open. My team continues to be really strained in critical staffing gaps. At this point, we have 20% of my nurses that are out on FMLA or restricted work conditions. I literally have 2 clinical managers who are working all day and into the overnight shifts just to maintain this. So we do have a lot of, we have new partnerships in play. We have started training for our EMS model, and I'll talk to that in more detail in a minute. We also do have new contracts coming for nursing staffing agencies, but those take a minute to play out. So, in the meantime, it's just, I will take a minute to champion the hard work that these folks are really doing. And it's a pretty critical state right now. And these solutions can't come fast enough. These solutions are also coming with their own challenges for the staff that we have to navigate through. And, and we've been able to, last month, we were successful in getting an hourly wage rate increase for the RNs. And some months before that for the MAs, I believe the LPNs had a similar rate increase last year. We also have 2 new incentive programs that are going in front of the Civil Service Commission to recognize those employees that we ask to serve as mentors for training new folks, and also an incentive program for bringing in referral applicants, folks that want to join the team. So I think my ask to the board would be to please do share any other ideas that come to mind that we can do to support the team now, just through these changes, but also to to encourage others to join the team. Recruiting pipelines are really strained in the nursing profession, obviously, and that is what led us to this new model of the EMS partners. But that's kind of the state. It's pretty challenging right now.
Valerie, thank you. So when the recent raises that went through that you referenced, did those go through the Civil Service Commission?
Yes.
Okay. Given that this graphic is showing that 35% of the budget remains, I'm not sure if that's start of November or end of November.
It was the end. However, just because of the accounts payable process, I know that things have not yet hit that reporting.
Okay. Regardless, it would appear from that percentage that there would potentially be some excess money. So you talked about the incentive programs, the referral program, and the incentives for mentoring. Is it possible to talk to the Civil Service Commission, or I'm not sure if it would need additional approval from the council itself But would it be possible to do one-time signing bonuses? Have you thought about that? I mean, I'm not sure if that's a good idea or not. I'm just throwing it out there.
We have thought about things like that. And actually, I just talked to Dr. Doucette yesterday to explore the potential, any possibility within civil service to offer bonuses for our current staff to work over the holidays, because that's also what we're seeing is a lot of folks in their shifts. I'll continue to explore certainly, but we weren't aware of any options that were available within the rules.
Jeff.
Aware of any options, and you're just not aware of any options to do signing bonuses within civil service rules?
Not that I know of.
Okay. Okay. All right. Thank you, Tim.
Jeff? Oh, are you calling on me?
Yeah.
So thank you for this, and related to the concern about open positions, and thank you, Jeff, for trying to strategize around that. In my other roles in health and public health, I've heard it said that nurses are in such high demand with COVID-19 that they're getting, if they're willing to travel around the country, and probably Spring or Alex can speak to this, but they're getting like $6,000 to $8,000 per week to sign up to work, to go around the country to work. So that's comment number one, is like, you know, that we're going into a market where that's how much that they can get. You know, that's a real challenge in terms of recruiting when we were already facing a challenge. And then the other comment I would make is, you know, my son actually just got a job after fighting for a long time to try to get a job. And he's working at a grocery store, and I was like, oh, amazed he's got a job. But one of the things that I was told was a lot of people are not willing to take those jobs because of COVID. They don't want to be exposed. So they're just kind of turning down these jobs where they're going to be exposed to others. So I'm wondering if this is just a very challenging environment to recruit people into situations where you're going to be potentially at risk. So I just sort of say those things, if they can be conveyed up to the council, you know, that maybe this is a time that, you know, I don't know if, you know, the extra funds are needed for recruitment, as Jeff was pointing out, and it's related to COVID in many ways. So can I throw that out there for comment?
I think you're spot on in many ways, Dr. McBride. I mean, we have had our colleagues who have left because of the concern over COVID. And even though we've had we've had a lot of luck, but we've done a good job too with mitigating the exposure here. But it's a real concern for folks, no doubt. And you know, and I think though what also makes all of this challenge helps us understand it in a different light is that so we now for many months now have been working with 3 contracted nurse staffing agencies where historically we only had 1. None of them have been able to secure a talent pipeline, give us any applicants. And so we're not getting any applications through our county channel either. So it is evident that we do have to change and think differently about our operational model, which is why we're really excited about this EMS partnership. But you know, even that, we're in the training phase of that now, so it's not helping this very immediate short-term staffing gaps. But it really does just mean overall that we have to think differently about how we care for our patients.
And it's going to raise the cost.
Mm-hmm. Valerie, how long is the training phase?
Well, most of so what we've done is they've been training this week, and it's been not every day. We've had folks coming in at different times during the week in different shifts because that's what they're available for. So we've been really agile we have a definition of the skills, the topics and themes, the modules that we've organized all of that into, and we are going through each of those with folks as they are here. And then we're pairing them with a peer mentor to observe the functional area. And we've had a little bit of delay with getting everyone access to the EMR because that's really where they have to have that hands-on experience before they can even start to become independent. So that's just taking shape today for folks. So at a minimum, we look to, regardless of this EMS model, but at a minimum, we look to have 3 shifts of true shadowing with our mentor before we will assign anyone independently. The benefit with these EMS partners is that they are taking 12-hour shifts. So we're getting even more time with them to be able to experience that. So it is not a long ramp up, but we're also working to, that's also where I was pointing to that 2 of our nurse leaders really is, both of them are working all throughout the day and night just to make sure that we've got appropriate mentors for these folks when they're available for their shifts.
So can I add something really quick to this, Mr. Chair?
Go ahead. Yeah, go ahead.
So I just want to also say that a substantial amount of detail has been prepped for this in thinking about the scope of work. So I want to be really clear with the board and everyone else too, that there are always in healthcare systems a variety of staff that participate in the entire care delivery process. And every provider all along that has a scope of work that is appropriate to their level of license and supervision and authority and everything else. And so this program was designed with a great deal of attention to detail towards a scope of work that is specific and appropriate only to the license, to the top of that license. Like we want to work people up to the top of what their license will allow them to do and no higher. And so these are disruptive not only because the training process is extensive, but also because it means shuffling around a lot of the staff internally and the communication and culture building that's really required in order to do this. But I do just want to make sure that everyone from this board understands that a significant amount of attention was paid to the scope of work of what EMS services are allowed and capable of providing in this environment, and those and only those tasks. They're not a replacement for the nurses, they're a replacement for tasks the nurses have had to do also because we only had nurses available to do them. And so nurses can do more nursing and what their license will allow them to do. But it does mean disruptions. And so we are aware of that and continuing to try to work on that as well. And the communication and culture building, all of that soft skills piece of this is important. But I want to make sure that this is something that this board is really aware of because it is explicit only to the level of care that the license allows them to do, and then frees up some staff who have been doing those things, but who can be doing more of the things their licenses allow them to do.
Thank you, Spring.
Yeah, thank you for describing that so well, Spring. And I would say that the EMS licenses, the EMT and the paramedics were positioned specifically in 2 functional areas where their skills and expertise are a really good fit for the needs that we see our patients have in those functional areas. So it is a different way of thinking. It's a little, we made some adjustments in one functional area to make sure that the assessment scope was appropriate for that license, and then strengthened the second assessment scope that the RN license is appropriate for. And I mean, overall though, it really is, it's certainly an answer to the staffing challenge that we and most healthcare provider systems has. But it's also an opportunity for us to have evaluated more closely what the more tactical needs of our patients often are, and to pair clinical skills more as closely as what we can to those needs. So it's pretty exciting. So we are in training with, we have 2 partners that responded to the RFP that were selected, and the contracts are moving along. The contract is moving along for one. We have been, we're in operational planning, conversations, and look to start with the second partner in early January.
Great.
Are those EMS partners, Valerie, or are those other staffing partners?
It's EMTs and paramedics.
Gotcha. Okay.
Well, thank you
For
guys
you.
for the update. Dr. Sutton, did you have more?
No, I just wanted to see if she could tell us who they were, or if that's still in negotiations and whatnot.
If the contract is signed, Valerie.
Okay. We have signed with Abbott. Is one.
Okay. Okay. Thank you.
Yep.
Great. Well, thank you, Valerie, and Spring as well for the insight. And thanks for thinking creatively about how to address this.
Yeah.
I'm going to move on. And Doug, you want to jump in? Or?
Right. I wanted to acknowledge something that Valerie did recently as well. She and Darby Howard, I received a phone call about a man that had been booked into the jail and from his family, and they informed us that he was scheduled for some really serious heart surgery later that day. And Darby and Valerie, Valerie made sure that everything was needed to do to take care of him while he was here in the short time, and that we were able to transport him safely. And within a few hours, he was at the hospital, and all of his needs were taken care of. And 2 days later, I received a glowing email thanking us about the level of care that was provided, and they really thought something bad was going to happen. This is something that Valerie and Darby just dropped, and it may have saved this man's life. And I just want to thank them for going above and beyond on it.
Thank you, Darby.
Yeah.
And thank
Yeah,
you,
Jeff,
Valerie.
and if I could just add a few words as well, I think Valerie and her team have done exceptional during COVID. Really just I think a model program for the country, really. So I just want to, I know I've told you this before, but continuing to do an excellent job. So thank you for that.
Hey, Jeff, I have a quick question.
Yes, Reverend.
Relative to vaccinations, I don't know if I'm asking Dr. Garza this or if I'm asking Spring. Will our medical staff be eligible for vaccinations? I see on the national news what the picking order is. Is there any way we can find out how soon our medical staff can receive vaccinations for COVID?
They will be vaccinated the day DPH receives vaccines. So we are an approved vaccinator site. The jail also has its own application in to be a vaccinator site, but that will apply more when we start to vaccinate the entire population of the jail as well. But the corrections medicine staff, our frontline healthcare providers in 1A DPH we're just waiting on our shipment.
Thank you. Thank you.
Can I share?
Go ahead,
Sorry. Can I share just 2 quick, really exciting pieces? I think that may just be teasers at this moment, but I can't wait to share more with you all as it plays out. But we were contacted by the Missouri Appleseed Project and are working, just starting to talk to them, but they have been working on a project to look at COVID mitigation protocols throughout the country. And so we're going to partner with them to not only talk about what we've done, but then to be able to learn what they've learned too. So we've just had a first meeting with that, but I'm very excited about what that will bring. And then the other piece too that don't have a lot of information other than that we're just starting this conversation, but we are also partnering with the Goldfarb faculty, who is going to conduct a trauma in the workplace project for the corrections medicine team specifically. They did the similar project for the animal care control staff in the last, I think it was earlier on in COVID. And so we talked with them this week. I'm really excited about that too, because we're looking specifically to come away or to focus on some goals that will support our staff with the trauma that many of us experience in general, even before COVID came along, and folks are really strained and stressed since this. But then also to really focus on the workplace environment so that we can find ways to help those staff feel empowered and to give them, a voice that they can feel goes through a channel that, that will be productive. And I'm really excited for this partnership because I think that just culture, the culture building that we are trying to do right now, I think that external partnership and knowing that partnership is coming from another group of clinicians, I think that's going to be really supportive for the folks. So I'll be excited to share more about those as they come.
Jeff?
And then very quickly on the COVID status, we do only have 2 COVID positive patients right now. I was just before this meeting, just following up on the lab results from earlier in the week, and we are not seeing folks come in through or from the community at the rate that the community is seeing with COVID positive patients. So the 2 folks that we do have currently, they were phase 1 quarantine when they were identified as COVID positive, but everything is going quite calmly.
Okay, good. Are you going to talk a little bit about 2021 COVID strategy? Before we get started, I just acknowledge Phyla Lee, our colleague on the board, has entered the WebEx. Phyla, are you there?
Yes, I'm here.
Okay. Good morning.
Good morning.
Okay. All right. Go ahead with 2021 COVID strategy, Valerie.
So this will also develop more in the coming days as we know what the plan will be with the logistics rather with the vaccine. But what we will continue to use all of the operational measurements, the protocols that we have implemented here for the facility. Those, I don't see ending at any time soon. Darby's team and I continue to talk on a regular basis to make sure that we're balancing that infection control with the evolving needs of the census. Just yesterday we loosened some of the recreation restrictions for some of the housing units because that's what makes sense right now for what those folks need. And we feel like it is an acceptable risk from an infection control perspective. There are still other mitigations that we can do. So I think all of that is going to continue within the facility. We will know more about, the plan or the time for offering vaccinations for folks in the facility. We've got the registration process in play so that Buzz Westfall will be its own facility for offering that vaccine. The comment that I would say around the vaccine specifically is that patients still have they can decide to decline any care. So we'll be looking for ways to increase, the success rate for folks wanting to take the vaccine. and always welcome for ideas on how to message that in a way that will be meaningful. But we will have certainly our clinical staff doing rounds to all of the housing units and talking to folks so that this is different than the flu shot, and we don't have a really high success rate of folks accepting the flu vaccine either. So we'll make sure that we are available to be able to answer people's questions, because this is such a new opportunity. But net messaging will be something that I think will be very important. Again, we have ideas and recommendations. And going beyond that, what we are looking at is to make sure that what the testing will look like with funding, if that reverts back to my team conducting the testing rather than a partner team and so forth, and then what our availability to the tests. All of that is evolving, but we continue to prioritize our environment as the congregate living setting that it is.
Valerie, since you solicited suggestions or feedback, my only thought would be, and this is probably not anything you haven't thought of, but just kind of given the history of related things in this country, just to keep the importance of cultural competency and credible messengers when encouraging vaccination at the forefront of your mind when we're talking to prisoners.
Can I ask a question back for that then?
You may.
Do you, are there alternatives than clinicians that would be better voices?
Are there alternatives
to the clinicians that might be
like the members of the board?
I'm not sure exactly, who, but just given the demographics of the prison population, given the history in this country, that I think will deeply inform responses to this, and public opinion research is showing around the country, as Dr. Garza, I'm sure, will attest, has shown, racial disparities in terms of early embrace of vaccination. I just think we need to be very mindful of that, and since we want to get as close to 100% as possible, having credible messengers, and the right people, I think, is critical. So, Dr. Nutt, your thoughts?
Yeah, no, I totally agree, Jeff. The messenger and the message has to be very appropriate, and it has to be acceptable to the person that's receiving the message. And so, just to give a very brief remark, we're working on sort of this multi-pronged strategy, communication strategy. And it's not just us in healthcare; it's community groups, it's public health, it's many different organizations, but making sure that we're developing the right message for the right groups within the population. And certainly, this is a population that needs a very a well-crafted and well-thought-out strategy as well. So totally agree.
Jeff, if I can.
Yeah, go ahead.
Yeah, we've been discussing this at the St. Louis Board of Health as well. So the point you made about distrust issues with the healthcare system among African Americans is well placed and goes back in history. So, I think the points were just made are important. And, I think messenger is going to be really important. And frankly, I think, keeping in mind, like the question you asked, Valerie, if you're trying to deliver a vaccine to another clinician, then a clinician is probably a good messenger. But I'm not sure a clinician is a good messenger for, a person who's in the jail. Might be, but might not be. You asked if the members of the board would be a good messenger. Frankly, I'm probably not a very good messenger. I'm a professor at WashU, so why would they listen to me? So I think, it's probably got to be somebody who they think of as a credible messenger, who could be somebody they would would listen to and get over that distrust issue. And, you know, to tell them that this vaccine is to be trusted. There's a lot in, you know, you get the point. So, you know, I don't know who among that, you know, who that messenger would be, but I think they're struggling with the same questions in the city as well.
So I think going back to something that Jeff said earlier today, this is community engagement. And the community engagement, I think you have an opportunity to be talking to people because it's going to be several weeks before we have the opportunity to vaccinate in this population. So we have a lot of opportunities to listen and learn from the population that's present about their concerns, their questions, like what are their ideas in many, like ask the population for ideas and particularly ask about messengers or about concerns or about the questions that they would want answered until and I think that the message can't start fast enough that it won't be mandatory. I get questions from this from staff and a lot of other pieces. This isn't mandatory. It is an offer that we need to be willing to back up with discussion and science and information to anybody who asks. And that is equal to the community. And it's the same message that we have for other members of the public, at least, you know, from the health department standpoint, is we're here to answer your questions with the knowledge that we have, and we'll make that available to you so that you can make the best choice possible. It's no less a decision point for those that are in our care in the jail. So it is an offer to you that is available for your own engagement, and that I think there's no time too soon to make sure that is a conversation and message that you're having.
All right, Valerie, back to you.
I think those were the main points that I wanted to hit. We do have Mary and Doug and I have had some communication and editing around the communication model that we had proposed for committing to with the board. And if that is an appropriate time to talk more about that, we can, but otherwise I will defer that back to you, Jeff.
Okay, we're good with that item. Valerie? Okay, any questions for Valerie from the board? All right, thank you so much, Valerie, for everything you're doing. We know how hard you're working, and we appreciate you. All right, ideas for staff recruitment, that was kind of subsumed under what Valerie
Actually, with me too.
Okay, you want to talk about it too?
All right. We are having issues with correctional officers not getting applicants in. We have a current class taking place that should have 15 new staff in the training. We have 7. We do not have enough staff to start another class in January at this point. What I've done is reach out to the directors of criminal justice programs at 5 different colleges and universities in the area. 4 responded back that they would try to help with this. I'm also going to reach out to the directors of the social work programs at colleges and universities in the area, and I think, frankly, that's probably who we need more. When Valerie ran the numbers on Tuesday, we had 912 people in the jail. 250 of those were on psychiatric medications. And I think with having correctional officers with a background in social work would probably be a real blessing. The real problem we have is there is a jail within this region that pays more than what we have for a starting salary. We've had staff that get trained here then move over there. And so we're just really looking for ways to widen our net to bring in qualified applicants. And I would ask the board's help and perhaps thinking about that and any ideas that we have on trying to get more applicants in that want to help us evolve this facility.
Hey, Tim, you're in the ground school.
Yeah, when you, we can have a conversation, Director Burris, about, I can connect you with our school to see how we can make that happen. Our career office, our dean. Maybe we can sit down and talk.
That would be wonderful. Thank you.
All right.
Jeff,
Something else?
Yeah.
Yeah, Mary, go ahead. I'm sorry.
I don't know whether you can see us or whether you can just hear us. So I want to get in but politely. This is a strange marketing strategy, and I'm perfectly aware of that, but I think we're in a strange time. I thought about it when Valerie was talking too, and maybe it's all understood by you guys, but I don't think it's understood by the larger community, the success that we've had in this jail in keeping COVID out, and when it comes in, keeping it safe. And we have talked about making a bigger splash about it. I'm glad that Valerie's getting some national recognition for it, but you know, most of the news in the paper is about how COVID is spreading in prisons and spreading in jails and how terrible it is. And we are really different than that. And if there is, to some extent, people are concerned about if that even factors into their willingness to come and work with us, it might be worth finding some way to say, you know, you may have heard some stories out there about other places, but we have had a strategy from the very beginning that has been successful, and only have had very little community spread. It's mostly come in from the outside, and when it has, our protocols have been shown to be successful. So
it's very timely that you mentioned that, because of something that Doug just did this morning, which he'll explain right now.
Ray Hartman on KTRS 550 is doing a program on this at 9 o'clock this evening, and the local public radio station is interviewing Valerie at 11 o'clock this morning for a featured program as well.
But Valerie is good. I will say she needs to be encouraged to tout this a little bit more, because I think she is loath to congratulate herself or the jail on these efforts, and I think she just sees them as part of her job. And I'm here to say that if I look at I've been keeping up on COVID around the country in jails and prisons, and we are really remarkable, and we should say that we're remarkable and say that even though there is some risk, this is one of the safest jails you could work in.
Right. The rate right now is 1/5 of 1% of our population being positive.
So Valerie, I would encourage you to come out of your normal, humble self this morning, okay?
Note taken. I just say it is not my skill that has done this. It is no doubt the entire facility that it has taken to be where we are.
Okay.
And let's all support Valerie in that effort. You know, Mary, Tim, me, those of us who are on social media, you know, that figure 1/5 of 1% is pretty extraordinary. So let's be vocal about that. Go ahead, Reverend.
I just wanted to back up what Mary just said, and respectfully, Valerie, you still gave the answer because you're so humble. But at this juncture, what we have experienced as a jail, as a justice services, it would be good for that to be elevated, and that the message be sound. Understandably, I heard you say duly noted, Valerie. Now we're just asking you that you noted it, that we're going to wait to see how you amplify it. And then just going forward, from a platform standpoint, Director Burris, you know, I'm going to reach out to you because we've got to start changing the image of the jail. And many times we have had some very good news. Unfortunately, it gets swiped away by some other untimely events. It's time for us to be a little more proactive and not be so subtle, because this is huge. And as everybody on this board has recognized, where correctional medicine has come from where they were to where they are now, and nobody anticipated COVID would come in as tragic. And Jeff, just on the record, I'm going to volunteer to work with Valerie on this vaccination. The discussion we had earlier, I agree, cultural competency, and I'm going to reach out, Director Burris, and share with you my thoughts on how we can probably strengthen that message to the inmate population of those that are of color. And while I have the mic, I think what I want to go back to, Director Burris, you were talking about competitive. Are our correctional officers, are they at the maximum ability right now? Do we have the finances to give correctional officers the maximum amount of money in our budget?
Reverend Duvall, I do not know the answer to that question, and I will get the information and get back with you. I apologize, I do not know that right off the top.
No, that's fine. And I'm concerned, equally concerned, as we're looking at correctional medicine, because we know we've been struggling with that. Now it appears, and you just correct me if I'm wrong, that when this turnover or our lack of retention of correctional officers, because we've been down this road before. When we first got on this board, we were averaging 35 to 40 people short, which then inflates overtime. And I know we'll be able to discuss that a little later in the meeting. But what have you been able to glean from a pattern of how we're dropping or losing this many officers? Because just prior to you coming, we felt we were finally getting to that point where we had a pretty substantial amount. Now I'm concerned that we're back to this, low amount of manpower, which drives the overtime, which makes the place unsafe. And these are discussions that we had prior to you coming. And I just want to make sure we're making note of how do we get out of this before it continues to be a monthly issue of bleeding talent, not bringing in, and I'm a little familiar with what the previous administration did, trying to cut that down. I'm curious to know, are we going back? And maybe the deputy director may know a little more. Have we gone back to some of the things we did prior that's causing the same problems? Or is there something specifically happening that's bringing us backwards?
In my 12 weeks here, Reverend Duvall, what I have noticed is that it is not the experienced staff that's leaving, it's the newer staff that comes on and leaves quickly. I can also tell you that previously there were tests that were done on applicants to make sure they had the math skills, other skills to do counts and other things. And we have found that taking those tests away, we've had people that have come in during the training that are lacking in some of the basic areas required for the job. We have worked with the HR department and are talking about bringing those tests back. But I have to say that I have friends in the private industry and other government agencies, and they share that it's the age group of this young and middle 20s group that it's nothing for them to have 3 or 4 jobs in a year. That they are not really necessarily interested in a career. If they land one, that would be great. But lateral changes for just a little bit more money is pretty common. And Darby, what do you have to add to that?
I just want to add, as far as going backwards, I think what we did early on, we rushed people through, as you said, that probably weren't qualified at the beginning. We took shortcuts. We're paying for those shortcuts. They're starting to show up now, where people can't do the basic reading and writing skills. So they get towards their probation, we notice that the decisions that have to be made. We need to really implement the testing. We need to, better, get more, competitive wages. And the beginning to draw a more qualified candidate. Because right now we took the shortcuts and eliminating certain processes that now you get into report writing with something that's a legal document. You got to be able to do it. So you're doing those things. You see that these some of the people that's the best that they have, that's the best skill set they have, but no fault of their own. But it's just now, it seems to be legal challenges. we have to make a decision on. It's trying to get that better candidate with the competitive salary. I think that's what we need to do.
Okay, and if I could, Jeff, could I continue a little more dialogue on this? Okay, so let's talk about this testing, because I've asked the question, how old is the testing? What the county has done, what I'm understanding, is the testing that has come through HR, that test may or may not be updated. And then, why this is such an issue, again, as we talk about safety, overtime, retention, duly noted, Mr. Director Burris, that these are the signs of the times, but every industry is still bringing in Gen Xers with the same mentality, and every industry is facing its challenges. I'm more concerned now, what are we doing to make some adjustments to keep up with the times? Meaning, is the testing adequate? Does it address what you're saying, Director Darby, in terms of their writing skills? The police departments all across this nation have faced the same issues of bringing in competent officers by making sure we don't reduce the competency level. Now, I'm sorry, I just don't think this is as complicated as just writing it off as, well, it's because generational, they're not suited to do a career. It requires another component that we do have control of. We don't have control of how people are growing up. What we do have control of is mentoring, and I'm talking about now staff persons, mentoring the new talent coming in, locking on to them, and trying to show them the way, instead of just putting them in there and then ridiculing them by their poor communication and writing skills. I think it requires both. And the numbers are now starting to bear out. This economy that has this many people unemployed, I have a very difficult time believing that we're not bringing in or receiving any applications. So somewhere in the pipeline, let me dig out some of the specifics, because what I hear we're saying is, we know we have a problem. We're looking at the problem. Meanwhile, the overtime's going to go up. The morale is going to continue to go down. And just my final statement, how often do we lock in personnel in that jail?
Lock-in has been an issue because, of course, we're short right now. I want to just go back to the first question in regards to the testing. We are looking at a different method of testing. St. Charles is giving us some ideas that they've had as far as a different test. The test that they brought in, now the police department of St. Charles is using. As far as the mentoring and developing the new staff, what we're doing now, because we've got so many new staff, we're trying to re-engage our experienced staff by getting them close to where they are. You can't mentor from a distance. You got to be right there with the new officer. I've been there, done that. I think the new method took away the experience and placed us, we separated it. So we now got to re-engage these new people by being their first, got to contact, even develop a new supervisor, because they don't really know. So you got to get the veteran staff back in place, develop a new supervisor, with a new supervisor, develop and mentor the new staff. You got to get back to the close contact with the veteran staff. You just don't have the veteran staff. People have left, people have retired. You lost maybe 5 or 10 senior supervisors just in a 3 to 4 month span. Just a lot of experience taken out of the jail. We just don't have it anymore. What we got to do, take the veteran people, even like myself, who's been there numerous years and knows the facility from top to bottom. I got to get those people back up into the jail, close to those new supervisors, new staff, and teach them, mentor them, and develop them, and coach them up. That's what we're
and I'll leave it at this as we continue in the agenda. What's interesting, again, Director Darby, as you're saying, people who are retiring, people with talent, that's not just happening. Those are things that we should have saw years ago. It's no secret when we're going to have a turnover. It's no secret when we're going to lose talent. There's got to be proper planning, proactive planning to address those needs. And right now, if we take a snapshot, because I'm curious to know in the 12 weeks, Director Burris, when you look, please, I implore you to look backwards and see where those gaps are, because we'll see a trend. There is obviously a trend that we are reducing, and so there is no surprise of people retiring. There is no surprise. Matter of fact, you already have that in your budget. You've looked at your budget. You looked prior to this budgetary that we just passed. You looked at what the fallout was going to be. And now the question is going to be in the next few months is, why was our overtime so high? B, when we knew in advance that people were leaving, we did not have a plan now to address what's coming. And so we'll wait and see, but I'm going to continue to challenge the numbers, not based on opinions, but based on facts, and then dig out why these numbers, there's got to be some underlying issues that's causing this. And it's not something that just came up because people are retiring. Thank you for that time, Chairperson. I apologize for taking up so much time to the rest of my colleagues.
That's okay. No apology is necessary. So can we do an exit survey?
What Darby said was that the HR department across the street was in charge of that.
So maybe that's something we should reinstate, kind of pretty quickly, so we can get a better idea of some of the reasons for people who are exiting. And then do you want to, Reverend, would you like to see Director Burris report back maybe next month to us with a little more kind of richer analysis of the numbers from 2020? How many retirements there were, when they came, and then maybe report back with kind of a draft of an exit survey?
I believe that would be helpful.
Mary?
I just want to remind folks that that was taken into consideration when we delivered our scope document to the county executive, in terms of one of the things we asked for was looking back and interviewing former, not just folks who retired, right? But at least within a picture, within a framework, interview people who have left the jail and find out why they left.
Doug, do you have thoughts?
I'll report back, but Reverend Duvall, when you were talking, I was thinking I've had senior staff report that they would really like to, let me back up. Some of the junior staff have reported that they would enjoy mentoring, and I think what we really probably need to look at is developing an incentive program for the senior staff to do that, because there is no incentive for them to do it. It's just more work to take on. So perhaps I could work with the board on that too, on ideas to incentivize the more advanced staff on doing mentoring. I can tell you that I'm here because of mentors in my life that took the time to help shape me. And I think that's one of the more important things that we can do, is establish that here as well.
I appreciate that.
Okay.
So yes, I will submit for next month's meeting with a little more specificity in a timely manner, so we can have a further discussion on that. So I appreciate the comments.
Thank you, Reverend. Okay, department audits.
Right, and this is an item that I asked to be put on the agenda. I originally, before coming into corrections, I was in the healthcare field, and we always had audits from the Joint Commission on Healthcare Organizations, where they would come in and see how you're matching up against other practices. And so what I would like to do is to take a look at every department that we have, and I reached out to the director of the St. Charles Jail, Daniel Keene, and asked if he would be willing to do an audit of our internal affairs department and our transportation department. And he agreed and would like to schedule those in January. And I just wanted to make sure, I've asked the board's advice this is something that we feel would be appropriate to do.
Yeah, just speaking for myself, Director Burst, I think that's an excellent idea. I think anytime you can have a set of fresh eyes come in and give you some thoughts and considerations for how you can improve practices, it's always a good thing.
Thanks.
Anyone else?
So just to be clear, though, this would not substitute for the regular accreditation process that you guys go through as well, correct? It would be in addition to. Okay.
Yes. Okay.
Can I, and to follow up on the question though, I don't know what criteria they are going to use for the audit. Just so that you know, well, you probably already do know this, Doug, that right when this board convened, it was at the time of our last accreditation visit. And there are some of us on the board who are very familiar with Joint Commission and very familiar with these kinds of accreditations and announced visits. And, and we came in after 5 deaths. And since then, there have been more problems. And yet the audit from our accrediting agency said we were just fine. That's what we heard. That our policies and procedures were in good shape. They did suggest some things they did see some things in terms of the physical plant, but things were okay. And at a time when we knew they were not okay. So I would just say, if this is a piecemeal way to not do our external investigation, which we asked for, including internal affairs, I'm concerned about it. And then secondly, I'm concerned about what model they're going to use for auditing, because if it is the accreditation model from the body that already accredits us, I don't think that will show up in anything that we haven't seen before, because we know policies and procedures are not necessarily the issue. We know that day-to-day practice and culture are our problems. And systems that may not be as tight, but that nobody's pulling out a policy and procedure book during their shift to look at. I would guess, because it doesn't happen in hospitals very often either. So I just, with those warnings and concerns, I'll leave it there for the rest of the board.
Mary?
Yeah.
Would this be an appropriate time, do you think, for a check-in with Beth or Steve to see if they have any updates on a broader investigation?
Well, I think last month put that to rest. I think last month the message that I heard, I wasn't going to raise it, because the message I heard was that, my interpretation is they're going to continue with their personnel investigation. And when that concludes, if it concludes, then they'll consider whether or not we're going forward with the external. And I think my fears about it dropping into a black hole were, at least for the time being, warranted. So I wasn't going to bring anything else up about it, because I thought it was a deeply disappointing response from the county executive last month.
Beth or Steve, do you have any updates for us?
I do not have any updates for the board at this time.
Thank you, and we will, I presume we'll be kind of checking in with you each month to see if you do. So, but thank you, Beth.
I'm sorry, Joe. Ms. Orwick, where are we relative to the findings that I can't remember, the Jennifer Joyce, is that report? Yeah, is that completed? You mentioned last month that it hadn't been completed. And I also asked you, when it is completed, how will it be dispensed to the public? Any update on that?
It's not been completed. I appreciate your questions, Reverend Duval, and your concern. Mr. Smith and Ms. Taylor. However, I don't have anything else that I'm going to say about as far as procedure or timing today.
Okay, thank you.
All right, let's move to the next agenda item, the DJS dashboard.
All right, thanks for putting that up, Tricia. All right, hi everybody. Not a whole lot to update on substantively this month. I just wanted to note a few things. One is if you look at the middle right one, average monthly population by race gender, you can see that the overall sort of average, daily average population in the jail went up again from October to November, but with the caveat that if you look at the upper right corner, the daily population, you can see that sort of it hit a peak in mid-November and then has actually declined over the past couple of weeks. So that increase from October to November on average has occurred. However, that is largely concentrated within the first half of November, and in the second half of November, the jail population has decreased pretty significantly. Actually, I think it's about 40 less than it was at its local peak about 2 or 3 weeks ago. Maybe 3 or 4 weeks ago. Not much else has changed. I did want to note that we had a slight jump in the average monthly length of stay for the inmates released in November. Otherwise, not a whole lot to report substantively in terms of changes for this month.
Aaron, is that modest increase in the length of stay attributable to COVID-related delays in the court system?
You know, that's long been a suspicion, but the data itself really, I can't point to one reason, you know, causally in terms of the data itself, because, you know, the data just are what they are. They just are the length of stay data, but that's certainly that the COVID-related delays in the court system is certainly, at least qualitatively, a reason that we've been hearing and talking about for the last few months. So I would suspect so.
Mr. Chair?
Is that Tim?
Yeah, if I could real quick.
Yeah.
Just real quick, first of all, these dashboards you're doing is just fabulous. I think they're really important that we're doing this, and I applaud you for all the efforts. The transparency is amazing. On these daily populations, you know, I was staring at this. I love data, as you know, and you know, I think we all know this as members of the board, but I just think it's worth saying out loud. You know, the trends we were seeing prior to COVID are pretty obvious on that graph. We went from like 1,100 to 900 when COVID hit, and then down to 700, and then now we went up to 954, and I duly noted that it's dropped a bit. But you know, the point is that we kind of back up to where we, you know, the 900s or so, which is a little concerning. And I realize that's not the jail's fault. It's the fault of the COVID and the justice services system itself that's causing those delays. But, you know, I just sort of point that out for people listening, that this is a concern because it creates the stresses in the system that Reverend Duvall was talking about earlier, because as we have fewer staff on both the correction side and on the health side, the ratio of inmates to staff is rising and causing more need for overtime, and it's just going to cause more stress. And you know, I think it just needs to be noted, it's going to cause more cost to the county. So so, you know, again, you know, I suppose there's not a whole lot we can do about it, but it's not great because we've been making such good strides on this.
Thank you.
Tricia, do you want to show the other one? All right, thanks. Just a few things to note with the supplemental dashboard. One is that the ER runs per 1,000 inmates has been very low, continues to be low relative to the last couple of years in this month, November. I also wanted to mention that if you look on the bottom left corner, social and professional visits by month, we've added a third category, and I actually need to change the title of this to illustrate that, to match with that. But there's a little green section on the November bar, and that indicates the number of video visits because we've started doing tablet, iPad visits, and wanted to include that in the total as well. So from now on, that bar in the bottom left chart will be split into 3 and not 2 sections.
Thank you, Aaron. Are there any questions for Aaron?
I did want to mention also that I think last month I debuted 2 new drafts of what medical dashboards are eventually going to look like in this format. We didn't feel the need to go over them again this month because Valerie presented the dashboards already, but just wanted to keep you all posted that we are hoping, at some point soon to be able to debut those in this format, in a publicly available way. But for now, those two are being updated monthly, just like these are, but they're not publicly available yet.
This is good work, Aaron. It does keep moving us forward from some of the conversations that we had in the data subcommittee. So thank you.
Yeah, no problem.
All right.
Jeff, I think that's all.
Okay, thank you, Aaron.
Sure.
All right, I guess we just kind of got the jail census status. Anything else to add? Okay. So there was a booking incident that we all read about a couple weeks ago, and I've learned a little bit more information subsequently. Doug, do you want to share that with the board?
Right. After I was advised of this incident, I obtained a copy of the booking in sheet and the criminal records check, and I verified that the jail did not book the man in with his name transposed. He was booked in correctly. I know there was one report that stated that it inferred otherwise, but this is still something that we just cannot have happen again. And this was a great opportunity for us to get creative and come up with a way to fix it, make sure it doesn't. And Tricia Rogers met with the people that have our criminal justice system here for all our information, Regis. And Tricia and Regis have developed a program where if we enter Doug Burris and nothing comes up, the program will automatically run Burris Doug. So this will hopefully be fixed and not happen again. But Regis was great to work with. They thought it was something they could develop extremely quickly, and we're implementing it, I imagine, before the first of the year. In addition to that, I thought it's a great opportunity to see other areas that we could perhaps learn from that. And so I had Jeff Seiler do an investigation on it, and I think Jeff's is able to report his findings on that now.
Could you, Doug, please let people know, because the community is listening, who Jeff is.
Okay, I'm sorry. Jeff Seiler is the head of the internal investigations for the jail. Thank you, Mary.
Okay, any other questions on that? All right, let's go to the.
Jeff's going to talk.
Oh, I'm sorry.
Jeff, are you there?
I didn't.
He was on earlier.
Jeff, I took you off mute. Can you try talking again?
Darby's checking on Jeff's status. Under new business, if it's okay.
Yeah.
I'd just like to report that the staff survey that we put out 2 weeks ago closes today. We're going to review all the information from that report, and I can say that about every single person I've talked to told me that they have done well over 150 people I probably asked, and they told me that they did complete the survey. So I think we're going to have a really good turnout on it. And I look forward to the employees here having a say on how we're running the facility and how we can improve it. Additionally, even though we closed the Coke Drive, we continue to get some more in, and I think we're more than good for a very bitter winter if we have that this year, and we'll have some probably left over into the next year as well. I want to thank the Clark Fox Family Foundation for spearheading that, and they really were quite successful in their efforts. Okay.
Yep. So I'm Jeff Seiler. I'm Integrity Unit Manager for the Justice Service Department. I looked into the matter of the Brentwood hold being held longer than expected or anticipated. When the judge came up to do an arraignment on the inmate, he asked for the person by his first name as his last name. He showed the booking sheet to the lobby clerk. When they could not locate the person, there were actually two lobby clerks trying to locate the person, and they were unable to locate the person the inmate that they were looking for. So the judge held up the booking sheet for the lobby clerk to get the name off of. The lobby clerk is not normally reading booking sheets, and they're very jumbled, very difficult to read if you don't know what you're looking for. The information on there is bunched together. So they tried to find the search again. They told the Brentwood judge that the inmate is not in our custody and had never been in our custody. The judge reported that I've got to go check my information and I'll have to see what's going on. They assumed that he was going to check the information, come back or call back to get that search done with the correct information. There was no further contact from the judge. So when I talked to the judge, he reported back to his clerk, and he said that the person had never been in custody, and the clerk somehow came back with, she thought he was released to the city, which was, we would never convey that because we couldn't even find the record. The lobby clerks could not find the record. So there was some miscommunication, some tools that we could do better, as Mr. Burris explained, for the searches. The lobby clerks don't have the search tools that most supervisors have. It's been recommended that if someone comes in and that person cannot be located, that person is referred to the lobby clerk supervisor, and he will have those tools and ability to do a more thorough search, and has the knowledge of how to read booking sheets and search for more demographic detail that would identify the person. So we're hoping that these changes will assist us so this does not happen again. Also, we have another staff member who reviews the mini holds and speaks to the clerks on a daily basis to verify what holds we have in our facility, so that justice services and the municipality are on the same page, and no one gets lost.
Every day.
Well, that was my recommendation. I do not know if that's been implemented.
What Tricia Rogers is running the report for me daily on any person that's been here on the hold for more than 24 hours. And since this incident, there's not been a single one. So we are doing, I'm taking personal responsibility for this to make sure that we're doing all we can. And Tricia's been great in helping me, and especially with her work with Regis.
Okay, I get questions from the board.
Yes, I have a question.
Kevin.
Was there no way, seeing that, okay, I guess I'm a little confused. The Brentwood person, the judge, inquires. There was no way then that our jail could make inquiries just of everybody from Brentwood Police Department around that time. We know we have 55 municipalities. And here's this one small, Brentwood is a very small city, is inquiring about somebody they brought to the jail. There was no way that our system could catch how many Brentwood officers had brought someone to the jail and find out in a timely manner. There's nothing in the system.
Our system does have that capability, but that clerk does not have that capability. That's why they should be referred to the bonding supervisor if someone is unable to be located, so that bonding supervisor can pull up that report where that lobby desk clerk does not have access to those reports.
Okay, so when or how did we catch this? How did we catch the error?
It was discovered by the clerk that works with the municipalities, and when she verified with that clerk on that Tuesday, then they compared and it was discovered.
Okay, was that clerk in booking? I mean, where was this clerk assigned? What part of the department?
She is an administrative clerk. She's up here, not in intake.
Reach out to, I know the answer to that question because this prisoner found out about this from the Post-Dispatch. So I guess my first question is, did we ever reach and apologize to this person? And if so, who did it?
Mary, this is Doug, and no, we have not. I think that's probably something real appropriate that we do. And I think it's also appropriate we share what measures we would take to make sure nothing like this happens again.
Well, yeah, something like this will happen again in a different variation. I suspect. I would love Alex to give his comments on this, but I'll tell you, I'll tell the rest of the group what I know I've already expressed to you, Doug, and that is that this is a perfect example of a system, a cascade of events that happened here. This is not one person. This is a system that failed, but it can fail in many, many different ways. And so the only way you can prevent doing one of these investigations for every single variation on the problems is to unearth everything that went wrong, every single weakness, not error, but every single weakness in the whole cascade of events from beginning to end. And I would say the apology and reaching out, it is so far overdue. And we know this in medicine. You have, when you know you're wrong, you say you're sorry right away. But you have to be clear about what you're sorry for. And if you haven't looked at this whole cascade of events from the time he came in to the time he left and after, you're going to miss opportunities to prevent other things from happening. What we've done is seen this as a unique situation that will never happen again. And medicine made the mistake of saying to people all the time, we're going to look at this and find out and fix it so it'll never happen again. And it did happen again and again and again until real systems thinking came on board. So, in medicine, this is what happened when we did operations on the wrong body part, or we gave medications to the wrong people. And it's still, this misidentification of people happens much less frequency now because we looked at things systematically and did a complete timeline and notified and identified every gap from beginning to end, and then went back to do deliberate, systems-based fixes, and then monitoring of performance to make sure that the fixes were reliable. So I know I have said this, I've done this mini sermon many times. I have offered some of the templates and some of the basic systems which are on your own corrections medicine national website. Just basic patient safety root cause analysis. And I know it's different than in internal affairs, but it could be in partnership with internal affairs. And I'm sure there's some people in the county who are trained in doing, I hope there are, trained in doing root cause analysis or failure modes effects analysis. But I have to tell you that I know we're going to talk about board communication, Valerie, or, and Doug, but, as a board, I won't be satisfied unless I see a summary of it and see a timeline laid out where we've identified every single connection, because I'm sure in 9 days there were other opportunities to identify this, and if there weren't, we ought to be creating opportunities to identify this, and it shouldn't be on one person, Doug, looking at the list. This is a system issue that could be a great opportunity for staff inside to see how things can be analyzed and improved in a different way. And Alex, if you have anything to offer, that would be helpful.
Yeah. So Mary, I'll just make a couple of comments off of what you've already brought up, which is, when you think about safety, at least what we fashion in the healthcare world, and I think for most industries, really, this is really a safety incident, and so you can't view it strictly as a punitive investigation. It's an opportunity to improve. And so that has to be really infused throughout the whole staff. Whenever there's a failure, there has to be this understanding that it's okay to report failures. In fact, that's the only way that you're going to improve, is to report failures. And it's usually not, and I think you guys understand this as well, it's usually not a person trying to do the wrong thing, it's that the system allowed them to do the wrong thing. And so what Mary's talking about is doing a root cause analysis where you keep asking, why did this happen? Why did this happen? And keep going down the line until you get to, this is why it happened. And then you come up with those 10 different reasons why it was allowed to happen. And so I would highly encourage the department to come up with a process to do a root cause analysis and have it be standard across the jail like it is in healthcare. So every safety incident that occurs in healthcare goes through very specific steps so that we review it all the exact same way. So when we walk away after talking about it, everybody understands these are the things that need to occur for us to prevent this from happening again. So whether that's, 2 vials were placed next to each other that had the same common name, stuff like that, which can be really simple, but a lot of times fixes are simple. We just don't recognize it. I do have a question though, and this is more of a process question. Is it very common for, so my understanding of the story is the judge came to the jail looking for an inmate. Is it very common for people like a judge to come to the jail and not be able to find an inmate, or come in with bad information? And the reason why I ask that is if this happens, 20% of the time, well, then that's a problem. But if it only happens like very rarely, then that's a problem too, because that should have then, set off alarms that, hey, we can't find this person, but I'm assuming that the judge has good information from his jurisdiction that says, yes, this prisoner is here. And I'm trying to understand, why could we not find this person? Even if the name was transposed, there's other ways of searching for people, I would assume, in a database, either looking for the jurisdiction that they came from, or a date range, or something like that, to narrow a scope for the search. And so I was a little bit confused by if we just looked at name and said, yep, he's not here, see you later? Or was it, gosh, we searched up and down, used many different fields, many different ways, and still couldn't find them? So does anybody know how that investigation unfolded?
Yes, I can answer that. It happens on a weekly basis. People come to the lobby desk looking for people that are not in our custody. They get the city jail and county jail mixed up often.
Mm-hmm.
They also.
Are those judges, though, that are coming from jurisdictions that are in the county?
Pardon me?
Are those, I mean, so it seems to me that a judge would have pretty good information about a prisoner coming to the jail. Now, I might be wrong because, you know, I don't work in the jail, but is that a fairly common occurrence as well?
Not necessarily with the municipal judge, but attorneys who happens to be the municipal judge comes up here looking for their client and they're in the wrong spot. People from the public come looking for their family members and they're in the wrong spot. It happens on a weekly basis. That clerk in the lobby could have done a search by booking date, and the judge requested that, but she did not have that knowledge of how to do that. That capability would be transferred to that lobbying supervisor to do that more detailed search and search criteria. The lobby clerks are at the mercy of the person providing them information. That information provided to them is the search that they do. If they locate that person, then what I've recommended is that they send that person to the bonding clerk to ask for a supervisor to do that more thorough search. Now, it could have been done that person could have been found, instead of using the full name, they would use like just the first three letters and then pull everybody up with that first and last name. And it would only be, if they said the last name was ABC, they'd pull everybody up with ABC, but only if that person was their last name. Those lobby clerks are at the mercy of the person asking to locate. They do not have the thorough search abilities and the training or even the computer rights to do some of those searches and pull up those reports. Those reports can be pulled up by municipality, dates, names. There's all kinds of things. If I would have been working on the lobby desk, I could have found it because I have that ability and those computer rights to search that stuff. Where that lobby clerk does not. They're at the mercy of what's given to them. So, and people, attorneys, a lot of attorneys come up here looking for their clients, and they're either at the municipality waiting to be transported to the jail and they're not here yet or booked in. They're at the city jail and they thought they were at the county jail. They're in St. Charles and Jefferson County.
Yeah, I totally get that. I think, from an attorney or the public coming in and asking, I could see where there would be some confusion. But I guess I'm thinking that why would a judge from a municipality be wrong about this? I would think that there would be a flow of information. I guess my point being is, how come there wasn't a heightened degree of awareness that says, why would a judge come all the way down here with bad information about where the prisoner was, especially from a municipality that was in the county? So to me, that seems a bit odd. So second point would be, if we're only giving the person who's responsible for relaying information limited capacity to actually find the data, then that seems like that's a problem as well.
And another issue that happens with these municipalities, per contract, if that person comes into intake and they have to go out for a fit for confinement or they have some medical issue, that contract, that we will not accept those people and they are never booked in. So the court thinks that person might be here. We send a tell type of message that they're not being accepted, or if Brentwood would bring that person in specifically and we would say that he needs a fit, or we're not accepting them for medical reasons, then he would never be booked in, and then that police officer would have to let his clerk and their courts know that that person never got booked in, and that happens quite often as well. That our medical people will turn municipal holds away, not so much since COVID, because there are very few community holds, but there are people that are thought to be brought to jail, but they never make it in. They never get booked in. And, you know, it happens with county police. They'll just release them pending a warrant, and then there are people come up there looking for them, they're turning, because they were arrested, but they were never booked in.
Mm-hmm.
There are times that people are presumed to be in jail, but they've been released due to medical conditions or some other.
Yeah. No, I get all that. So I guess what my question is what are we doing to fix the problem? So I've heard all of the, you know, there's some of the reasons why it happens, but obviously if we don't have a solution, it's going to happen again, right?
So like I said, the lobby desk needs to refer the person to the bonding clerk, to the supervisor, so a more thorough search can be completed. The clerk that's in charge of the municipal holds will also verify their holds with the clerk on a daily basis, excluding the weekends. That should prevent those municipal people from being lost or not accounted for or not arraigned in a certain amount of time. And hopefully that will stop or prevent this from happening again.
Okay. All right. So could I just ask, Mr. Burris, would you be able to give us a count then of the number of times that process has to be used for our next meeting?
Yeah.
Whether it's used like 1 time, 20 times, 100 times. I think that'll give us an appreciation of the magnitude of the issue.
All right, I got it down, Dr. Garza. Thanks.
Thank you.
Reverend.
Yes. So this investigation is complete, correct, Mr. Silent?
My investigation is complete, and it has been submitted to the director and deputy director for their final recommendations or whatever actions they decide to take.
So understandably, you know, to my colleagues, Mary and Dr. Garza, about root cause analysis, Mr. Burris, wouldn't that fall under change control? And does change control have access to this investigation?
I think that's a great idea, Reverend. What I did is I forwarded on to the legal department to see if they have any recommendations, but I will definitely pull in our change agent here because I think that is absolutely fantastic.
Okay, and then I'd like to request Mrs. Orwick, I know we have had access to reports in the past, especially under those jail death investigations. I'd like to know if we can get access to this incident so the board members, we can read it ourselves and take a look at the investigation results. Is that possible?
That is something that you'll need to bring up with Director Burris. And I will work with him as appropriate, but I cannot give a legal opinion during this meeting. But that's something definitely you should take up with the director.
Okay. Director Burris, you'll be hearing a request from us relative to this report of this investigation.
Great, thank you.
Thank you, Mr. Chair.
Jeff?
Yes. Oh, I'm sorry, I was just listening to some of the conversation here. I mean, I think there's a concern about whether or not that would need to be redacted, which I don't think, I don't think anyone on the board needs to see the names of the individuals who were, in these positions, at the key moments. But I think we need to see a timeline of what happened. I think we would like to see, as Mary suggested, an analysis of what happened at this point that went wrong, what went wrong at this point, what went wrong at this point. And Mary, you referenced kind of a template from corrections medicine. And I think what I'm hearing from the board broadly is that we would like to see some kind of root cause analysis template, not just for this incident, but for when things like this might come up. Is that accurate?
Yeah, if I could just comment.
There, go ahead.
I don't think I agree. I don't think any of us are interested in the names of people because I will just reference in all the industries, including medicine, who have been doing this for 20 years, by the way. So I want us to feel behind the time we are. One of the phrases we use is use the substitution analysis. If we swapped out any person with the same title within the jail, it does, and would these circumstances that exist still cause this to happen? And I would say, yeah, if you swap in, we don't know the full answer to that because we don't know, all the details of what happened. Although from Mr. Seiler's comments, I mean, it kind of made my case for me. There are many, many ways this thing can go wrong, I think, because there's so many different variations on it. So if you swapped out anybody else, any other CO or whoever was sitting, clerk who was sitting in that desk, would the same situation happen? I think, we're more interested in answering that. If the answer is yes, then how do we correct the underlying system that helps people be effective and helps people be do the right thing, and also a system that reminds them and prevents them from doing the right thing, a thing that has its own alerts built into it. So if I think I asked some people, is Tony Weaver trained in root cause analysis and these various systems? You can't come into this without a facilitator, I don't think, who's been trained in it. And the white paper that I have sent to every director, all of the directors and all of the board and some of the council members who have asked is on the National Association for Corrections Medicine website under patient safety. They have a patient safety white paper, and this is all a part of it. The problem is if you want to keep it closely held, you're going to need somebody to come in who has been trained in this and who has done it frequently. We're making it sound much more complicated than it really is. Once this process is in place and you decide that you're just going to use it, it's an objective way to approach everyone. It doesn't have to rise to a drama level. It doesn't have to rise to being in the newspaper. It's just something you do every day. You'll find that it is much kinder to the staff, and it is much easier to get to the truth of what happened. And I think it will provide the board too with some comfort and assurance that that we know every way this could have gone wrong, so that we can prevent other things in the future just like this or similar to this. So I would like to know, I've talked about this so many times, I'm not willing to leave this discussion without some expectation of whether or not we're going to go forward with better analysis that is accepted everywhere and is certainly touted by corrections. And if so, how are you going to move forward doing this? I would love to work with you, Director Burris. I think we're going to talk about it earlier this week and didn't have a chance to, I would have liked to have said this to you on a phone call and not in public, but I think we need some assurance that it's going to be different going forward. And this is not to blame anybody in internal affairs or any of the folks inside the jail for not knowing how to do this, because it hasn't been given to you. It's you haven't been trained in it. You haven't been taught to think this way, and it is it's just a helpful, kind way, very compassionate way to treat staff as well.
And maybe if I could respond, yes, absolutely. We will take the root cause analysis response. Before I implement a final plan, I'll give it to the board for approval to make sure that's, or for advice, making sure that's the plan that I develop is one that meets with the standards that's set up with the science.
Mary, did you hear that?
I did. Did it require a response from me?
No, but I was just making.
Okay.
You're fine.
Yes, I am.
Yeah. Okay, so is next month doable?
Oh, absolutely.
Okay, so the two things that we'll expect out of this agenda item is just to get a look at a redacted version, a redacted final version of this incident analysis. And thank you for taking time to go through all that with us. And then secondly, a template for, just institutionalizing, this sort of analysis going forward. And Mary, can you redistribute that you said that you sent to everybody? Can you just resend that so we're all working from the same document?
Sure, be glad to.
Thank you. Okay. So we had jumped to new business, and then I think, and then we came, and then, so I think we're good. Thank you, Jeff.
You bet.
Is there other new business that you have to discuss? Okay. Anyone on the board have new business to raise? Okay. Are there any comments submitted from visitors? Or any, or from the public? Tricia?
No, we have no comments today.
Okay, that's disappointing. I was hoping to get a warm welcome from the public, but all right. Well, we will entertain a motion to meet in closed session pursuant to RSMO section 61021, numbers 1, 3, 5, 13, and 14, and St. Louis County Revised Ordinance section 114.020.1, numbers 1, 3, 13, and 14, which I know involves a personnel incident that occurred here recently.
Moved.
Second.
Thank you.
I'll take roll call. Reverend Duvall. Reverend Duvall.
Yes.
Mr. Smith.
Yes.
Ms. Taylor.
Yeah.
Dr. McBride.
Yes.
Dr. Garza.
Yes.
Mitch.
It is a yes. I'll vote to enter closed session, but I have to leave. I have a media interview in 9 minutes. So.
Good luck.
Good luck.
So I do vote to enter closed session. I just can't stay for it.
Ms. Lee. Ms. Lee.
For must go into closed session.
Sorry, was that a yes?
Yes.
Okay. Mr. Chairman, we have 7 yeses.
Okay, we count on 7 yeses and 0 no's. We will now go into executive session, or into closed session. Do we jump onto a separate call?
Yes, there's a separate link for the closed session.
Okay.
Was that in the original invite? I'm sorry if I missed that.
I don't have it.
Trisha, just to make this a little easier, can you just resend the link for our closed session right now?
Yes, I'll do it right now.
Great.
Thank you.
Thank you.
We'll see you guys in 1 minute.
Okay, thank you.
Due to technical difficulties, we will be adjourning the meeting via an email vote. Thank you.